Have you ever looked in the mirror and noticed that your teeth appear longer, or that maybe your gums are beginning to recede? There's a dental technique that can help with that, and today we're sitting down with Dr. Rehl from Family Tree Dental to discuss this. Hi, Dr. Rehl.
Hey.
How are you?
Doing well. Thanks for having me today.
Absolutely. Thank you. So, Dr. Rehl, how long have you been in dentistry?
I think this is my 17th year now.
No.
Yeah, I know.
No way. That's not possible.
It's been that long. Yeah.
Well, that's wonderful. So tell us about this technique that can help with gum recession and the appearance of your teeth.
So one thing that we've noticed is that when we have patients who are really diligent about brushing their teeth, sometimes they are so aggressive that over time their gums will recede from the abrasion of the toothbrush. And, as a dentist, I would rather see that than the opposite end of the spectrum where someone has too much plaque or decay. So oftentimes these surfaces are nice and smooth and clean, but the gums have receded, and patients will start to get what looks like a little dark triangle between the teeth because they can see the airspace, the darkness between.
Okay.
And so, or recession on the facial surfaces of the teeth. When they smile, their teeth do look longer. And so the pinhole technique is a process by which we can rejuvenate the patient's gums by getting them super numb and comfortable, and then making a small pinprick size access. We can go in and lift the gums up and use some hydrated collagen to bring the gums back where they belong.
Wow, that's cool.
Over the course of about a process of about an hour, they can see the results immediately. And then, of course, there's a healing time afterwards. But this process is much more comfortable than some of the techniques we used in the past.
That sounds really neat. So it's called the pinhole technique?
Yeah, Dr. Chow in California pioneered it.
Okay.
So this pinhole technique is used to rejuvenate the gums and reduce that recession. It's especially important that we have good gum tissue between the teeth in order to hold the level where it belongs when we do the
I see. How long did you say this takes?
This takes about an hour.
Okay.
The procedure takes about an hour to do, and we take pictures before and after, and the patients are usually amazed. They can immediately see results.
Gotcha. Is it painful?
It can be tender. When you do work in the gums, it can be tender, but it's way more comfortable than the procedures that we had in the past. In the past, we would do connective tissue grafts and harvest gum tissue from the roof of the mouth and stitch it over the roots of the teeth.
Oh.
And aside from having to reestablish a blood supply and all that for the healing process, there were sutures required. And the pinhole technique does not require any sutures or any cutting.
Oh, that's wonderful.
Yeah. It really
sounds way more comfortable.
Absolutely.
Okay. Well, that sounds great. So who's a good candidate for this?
Anyone who has good oral hygiene.
Okay.
Is a good candidate, who has recession. Now, if it's minor recession, say a millimeter, then I might not jump into a surgery to correct it or rejuvenate the gums. But as soon as you see 2, 3, 4, 5 millimeters, it really makes a difference to be able to cover that surface. The roots of the teeth are not supposed to be exposed. They're supposed to be covered. And so recession can increase sensitivity as well as vulnerability to decay. And the pinhole technique not only improves your look cosmetically, but it also has the functionality of reducing sensitivity and reducing the chance of decay in the root surface of the tooth.
Wow, that is really neat. Okay, let's get down to what people are really going to want to know too. Is this costly? Is this something that insurance ever covers?
Family Tree Dental does a great job of working with your insurance. So if you have dental insurance, we would certainly submit that to your carrier and get a pre-authorization. The codes that we use for the pinhole technique are the same codes we might use for like another code that the insurance companies are familiar with.
Okay.
So we make sure that there's no surprises. Of course, if somebody's using the Family Tree Dental plan, we can work with that too.
Gotcha. So you do not have to have dental insurance to get this done. You could just come in, talk with someone.
You don't have to have insurance, and if you do have insurance, we'll do our best to make it work well for you and make good use of it. It's probably important to know, I like to use the analogy of the pinhole technique is similar to, climbing into the nicely made bed that's tucked in, and you climb into bed and you want those sheets up around your neck. And so what do? You'll roll one side, you'll roll the other direction, maybe loosen it, and then pull it up into a nice, comfortable way. That's how the pinhole technique works.
Okay, that's a great way to describe it.
Lift it and bring the gums where they belong, where it's most comfortable for you.
Very good. Well, Dr. Rehl, thank you so much.
You bet.
This has really been informative.
It was my pleasure. Thank you.
Our dental team would love to answer your questions and provide the solutions you're looking for. Contact a Family Tree Dental near you.